Joining us for this community briefing on our local COVID-19 response efforts. And thank you, Margie Prop, for being here, as always, to provide interpretation for our community. It has been a truly historic week as the first doses of COVID-19 vaccine, doses of hope, were administered right here in Lincoln. We received our first shipments of the Pfizer vaccine, and those doses quickly went into the arms of healthcare personnel, providing direct care to COVID-19 patients, and into the arms of our emergency medical technicians. The health department vaccinated 228 EMTs from Lincoln Fire and Rescue this week, and more are being scheduled. One of those who received the vaccine was Captain Scott Wiebe, who has been a paramedic with us for more than 30 years. He joins us now to tell us what that vaccine means for our EMTs. Welcome, Scott.
Thank you, Mayor. I appreciate the opportunity to be here to speak about what a tremendous effort went into actually getting EMS responders into Phase 1A. You know, the state of Nebraska has been certainly fortunate, and EMS in particular, by moving to Phase 1A. Lincoln Fire and Rescue, in partnership with the Health Department, vaccinated, as the Mayor said, 228 members of Lincoln Fire and Rescue. So far, we've had 28 members test positive, so some of them may have been excluded as if they tested positive within the last 90 days, then they may be delayed to get the vaccine. The reason I think it's important for EMS professionals to get vaccinated is we want to be there to provide health and safety for the community. I think we've done a great job of minimizing the impact of COVID-19 throughout our organization. But the threat's out there every day. I believe in the vaccine. I would encourage everybody to get vaccinated. It provides an additional level of protection. What you can expect from Lincoln Fire and Rescue is our responses will be there 24 hours a day, 365 days a year, and you will continue to see us wear the recommended PP as recommended by Lincoln Fire and Rescue command staff and by our health department partners. I just want to say, please, as the vaccine becomes more widely available, please consider taking the vaccine for the health and safety of our community. And please remember, please consider wearing a face covering, not only to protect yourself, but to protect the most vulnerable in our community. Thank you.
Thank you, Scott, and thank you to all the healthcare providers and EMTs for leading by example and the life-saving care that you provide to residents in our community. And you've been doing that from the very beginning, back when we were less familiar with the risks associated with COVID-19, when there was so much uncertainty, and transporting patients in ambulances without knowing if you were risking the safety of your families as well as yourself. So thank you so much. Thanks as well to our Community COVID-19 Vaccine Advisory Committee and community partners who have worked with our health department for months to diligently prepare for vaccine distribution. It really takes strong working relationships and a coordinated effort to run a successful vaccination campaign. And starting vaccinations with these two priority groups is part of our phased approach due to the limited supply of vaccine in this moment. We do expect more doses to arrive as soon as next week, and Health Director Pat Lopez will have more information on vaccines in just a few minutes. We are so grateful to scientists and researchers around the world who worked so hard to bring a safe and effective vaccine into reality. This is such a critical tool to bring about an end to this pandemic. And like Scott said, we encourage everyone to get vaccinated as soon as that vaccine becomes available to them. This vaccine has been called the light at the end of the tunnel, but for the time being, it is important to recognize that we are still in that tunnel. It will take time to get enough people vaccinated to stem the spread of this virus. National and local public health officials acknowledge that we still have an outbreak to get under control and that the pandemic will likely be with us for months into the new year. And so with this in mind, we urge everyone to focus on continuing to take the precautions that protect ourselves, our loved ones, our community, and our healthcare system. Let's continue to minimize contact with others from outside our households. Let's wear our masks. Let's stay at least 6 feet from others from outside our households, and let's wash our hands frequently. Every single one of us has the power to stop the spread. We also have the power to help others during this holiday season. And yesterday we featured several of the many ways that you can support very important community causes. And that includes giving the gift of life by donating blood. Our local healthcare system relies on a healthy supply of blood to care for patients. And here today to share more about how important that is to the health and safety of our community, as well as with a hospital perspective on where things stand, is Russ Gronewald, President and CEO of Bryan Health. Thank you so much for being here, Russ.
Thank you, Mayor, for giving us an opportunity to talk about this a little bit. We've had a really good week at Bryan. Our cases are coming down from a high that we've had. It's not quite where we'd like them, but boy, we are in a lot better shape than we've been before. And there's just been a burst of energy, positive energy, as we've been able to get almost, over 2,000 folks by now vaccinated this week. So that's a really great start for all of us. And so essentially, talking to the community, you've done what's been asked of you, and we're beginning to see those results. And so I think in some ways it's kind of hard for me to come up and ask for something else. Yet I've learned that Nebraskans have a real put-me-in-coach attitude, and so I'm going to risk asking for even more today. As we have been able to see those case numbers come down, we've been able to open up to some of our elective cases, the ones that are especially necessary. And one of the things that's been holding us back has been the availability of blood. Bryan gets all of its blood products from the Nebraska Community Blood Bank, and yet we've been having to hold off of elective and necessary procedures for 30 to 90 more days if we think they might require blood products in an effort to maintain the current blood supply out there. So we use them readily for our traumas and anything coming through the emergency department, things like GI bleeds and emergency OB situations. But there are many others that we've had to hold off on, despite a lot of the things that we've done in terms of trying to conserve blood supply. Right now, the current inventory at the Nebraska Community Blood Bank is just around 3 days, just maybe over 3 days. Once you go to 2 or below days, we're really into an urgent and critical situations. And frankly, 1 or 2 bad trauma events this evening could throw us into a situation like that. So 3 is really right at the edge of where we want to be. We would prefer very much a 7-day supply, and that's why we really need your help. In order for us to continue those surgeries that have been sort of backed up over time and we're waiting to get going, we really need to get closer to that 7-day supply. Almost 50% of the supply comes from mobile blood drives in the region's area. And the reason there are some shortages right now have a lot to do with the pandemic social distancing requirements. Fewer donors are being allowed to be scheduled at any one time. There have been more sicknesses or more cancellations because folks are concerned about the pandemic and those distancing requirements. So I hope you will consider giving blood. And as just a little bit more motivation for you to consider that, the Nebraska Community Blood Bank is offering free COVID antibody tested to all donors now and through January 31st of 2021. Maybe that benefit will encourage you to consider others to donate. There are several places here in town that you can do that, and 84th and 27th and Superior. But when we talk to the blood bank, they've said that the one that doesn't get as much traffic as it maybe could is the one on 16th and Pine Lake, and they can take 2 donors at a time every 15 minutes. So some of you donate regularly, thank you. Some of you just haven't done that in a while, and for some of you, it just makes you squirm thinking about that. We would not be asking if it didn't matter so much, so we would appreciate very much you considering giving blood at this particular time. Thanks.
Thank you so much, Russ, and for everything that your team is doing for our community. And just for those who are considering making a donation to the blood bank, you can go to ncbb.org to sign up. That's a Nebraska Community Blood Bank. ncbb.org. Also joining us today with an update on the status of our local healthcare system from his perspective is Derek Vance, president of CHI St. Elizabeth. And Derek joins us by Zoom today. Over to you, and thank you so much for being with us, Derek.
Good afternoon, Mayor. Thank you for the invite. It's been an exciting week at St. Elizabeth and Nebraska Heart. Similar to Russ's comments, a lot of positive energy around the vaccine. We received our vaccine early Tuesday morning and began vaccinating physicians and staff that very same morning. We're not requiring staff or physicians to take the vaccine. We are strongly encouraging it, as Scott mentioned. We've created a separate space at St. Elizabeth and Nebraska Heart for vaccine clinics where we can bring as many that are interested through in a day's time and get those vaccines completed. The vaccine clinic this week has been very busy. All slots have been filled that we've opened up to staff and physicians, and we will have gone through all of our doses that we received this week by Monday, end of day. So hoping for additional vaccine next week. One thing we've learned through the pandemic is that things change on a day by day or hour by hour. So our hope is to get more next week. We don't have that confirmed yet, but we do know that more will be on the way, and we look forward to that. So really excited for how it is felt at the hospitals this week, that tangible positive energy that is felt by staff and physicians alike of having the vaccine now in our systems. Also, similar to what Russ mentioned, we're grateful that our trend in COVID cases has dropped. It's also not where we'd like it to be, which is 0. It is down quite a bit over where we were just prior to the Thanksgiving holiday. And we had anticipated and gotten ready for a surge after Thanksgiving. And our big thanks to the community that we did not see that. And I think that's due to excellent choices that our community has made, and just feel very good about where we are as far as the number of COVID patients in the hospital right now. And we see that same trend across the state of Nebraska as well as the upper Midwest. So that's positive news for our area of the country. That said, our hospitals are busy, and it's not with the flu right now. We're not seeing a lot of flu. COVID is down. Honestly, we're seeing a lot of other things, a lot of surgical procedures, which is not uncommon for this type of year. But what is more concerning is that during the many months of the pandemic, it's clear that some have put off, understandably, medical procedures, things that they need to have done due to the pandemic. And so the patients that we are seeing, many of those elective cases are no longer elective. They're urgent and even emergent at times. So we're grateful to be in a position right now with COVID patients down that we can more than adequately care for our community, care for our patients. My ask is that we continue to be vigilant. The masking, avoiding crowded spaces, social distancing, washing our hands, all of those things we've talked about from the beginning, particularly as we approach another holiday week in the next week or so, a couple of weeks. So I think the worst thing that could happen with what we're seeing in the hospitals right now is to then have a surge in the next couple of weeks. And so that would be our ask, is to stay vigilant and enjoy the holidays, but to enjoy it in a safe way. So again, my thanks to our community and thanks to our mayor for her leadership through these challenging days. And thanks again for the invite this afternoon.
Thank you, Derek. Thank you so much to you and Russ and to your teams at Bryan and CHI St. Elizabeth for all the life-saving services that you provide. And we are so grateful as a community to you through this pandemic. And I echo your thanks to everyone in our community who's following the health department's recommendations and doing all you can to take care of each other. And because of your efforts, we are seeing improvements in many of our key indicators. Health Director Lopez will go into more detail shortly on that. And while we celebrate these improvements, we must acknowledge and be candid about the fact that our numbers are still very high. And for this reason, our COVID-19 risk dial remains in red for the 7th week, indicating that the risk of community spread of COVID-19 is still severe. The pandemic continues to claim valued members of our community, our relatives, our friends, and our neighbors. And in the first 18 days of December, we have lost 56 residents of Lincoln and Lancaster County to COVID. That's about 41% of the 135 local COVID-19 deaths. And on behalf of everyone in our community, I extend our deepest condolences to the families and friends who've lost loved ones to this disease. Health Director Pat Lopez is here with more to share about our indicators and more information regarding vaccines.
Thank you, Mayor. The vaccine that we have received so far is the Pfizer vaccine, and I want to begin with an update on the Moderna vaccine. Yesterday, the Food and Drug Administration's Vaccine Advisory Panel recommended that the FDA authorize the Moderna vaccine for emergency use. A final decision from the federal agency is expected to come quickly. Once the authorization is issued, vaccine can be shipped to the states, but the vaccine can't be administered until the Advisory Committee on Immunization Practice conducts its review. The committee that decides whether to recommend the vaccine to the CDC, and if that is the case, the committee finalizes the initial groups receiving it. If the Moderna vaccine moves forward, the state said it expects to receive about 32,000 doses in the next weeks. Vaccine supply will be limited for some time, and we'll continue to follow the phases that have been established. Phase 1A includes the frontline healthcare personnel, and as you have heard, our own EMTs, who started receiving the vaccine this week. Phase 1A also includes includes staff and residents of long-term care facilities. If we receive vaccine shipments as planned, we will be able to supply some of our long-term care facilities vaccine to start administering during the last week of December. Many of them are receiving their vaccine from pharmacy programs established by the federal government, but there are some we will need to assist. Over the span of my career as a registered nurse and as a public health professional, I've witnessed the release of several vaccines. I've seen the benefit they provided to those who received them and to our population as a whole. The COVID-19 vaccine will provide protection against the virus, reduce illness, and save lives. While COVID-19 vaccine development and approval occurred at an accelerated pace, no shortcuts were taken in the evaluation of the safety and effectiveness. People getting COVID-19 vaccine receive information about what to expect after receiving the vaccine. Some side effects are normal. They are signs that your body is building protection. The most common side effects are sore arm, tiredness, headache, muscle aches, and chills. These symptoms usually resolve within 48 hours. The CDC also launched a smartphone-based tool for people who receive COVID-19 vaccines called vSafe. vSafe uses text messaging and web surveys to check in with vaccine recipients following COVID-19 vaccination. You can find vSafe at vsafe.cdc.gov. We will continue to share vaccine-related information as it becomes available, and we ask for people's patience. Please know that the health department and our partners will be vaccinating as many people as we can, as soon as we can, based on the number of doses provided. The vaccine is not yet available to the general public, and vaccinating Lancaster County's entire population will take some time. We need to be patient and diligent in taking the steps to stop the spread of the virus during the meantime. We must continue to protect ourselves, our loved ones, and others by wearing masks, watching our distance, and washing our hands, and avoiding our crowded places, close contact, and confined spaces. Broad community spread still exists, and your risk of contracting COVID-19 is dependent on the choices that we all make. I join the mayor in thanking all of you who are doing the right thing. Because of your efforts, many of our indicators are headed in the right direction. Last week, we did see the first decline in weekly cases since the week ending September 19. We've gone from an all-time high of 2,112 cases the week ending December 5th down to 1,430 cases last week, a decline of about 32%. The last time we saw a significant decline was the 3-week period after the mask mandate was implemented on July 20th. Our case numbers at that time declined 57%. They did not start to increase again until late August. Today we are reporting 149 new cases, bringing our total for this week to 809 new cases at this point. The 7-day rolling average chart shows the steady decrease in daily cases. We went from an all-time high of 302 on December 5th to 146 yesterday. This chart shows how the 7-day rolling average of cases, the orange line, correlates with hospitalizations, which are depicted by the blue line. This week, we dropped below 100 hospitalized COVID patients for the first time since November 2nd. These are very promising trends. Because of the well-established correlation between case numbers and hospitalizations, we expect that the improvement in case numbers will translate into a decrease in hospitalizations and deaths in the coming weeks. Today, 86 COVID-19 patients are hospitalized locally, with 11 on ventilators. 49 are Lancaster County residents, and 37 are from other communities. The weekly positivity rate also declined significantly for the first time since the week ending October 10th. We have gone from an all-time high of 34% the week ending December 5th down to about 27% last week. This week, the rate has stayed fairly flat, fluctuating between 27 and 29%. While the rate is down, it is still very high. The COVID risk dial first moved into the red on Friday, November 6th. This chart compares key indicators from that last full week we are in orange with the indicators from this current week. At the end of October, the 7-day rolling average of new cases was 127. As of yesterday, the average was 146, still higher than when we were in orange. The weekly case count was 890 at the end of October. As of yesterday, we were at 661 cases. With the full week, including today and Saturday, we will still be higher than we were in orange at the end of October. The weekly positivity rate was 18% at the end of October. This week, we have stayed fairly flat between 27% and 28%, which is still very high. As a 7-day rolling average of COVID-19 patients hospitalized was 75 at the end of October, as of yesterday, the average was at 109, still higher than when we were in orange on the risk dial. So it is going to take longer than just 2 weeks to come down to an overall safer level and to move the dial out of red. This chart shows how all of our indicators are factored into the setting of our dial. We still have no metrics in green. Testing turnaround time is in yellow and has been improving. Connected cases and contact tracing are in the orange section and have been moving farther from the red. And the remaining metrics remain in red. You will find the location of the risk dial right on the edge of the red section, represented by the blue square outlined in red. As we've demonstrated throughout the pandemic, we continue to make local decisions based on local data and our specific situation. Fortunately, as of this week, we are confident that we have turned a corner and case numbers are going down. Thank you to the many businesses, including bar owners and managers, that have been doing what they can and following good prevention protocols. We understand it does not come without sacrifice. Your efforts are preventing more illness and death in our community. As we did with youth sports, we have continued to review protocols and work with the businesses to find additional solutions. Due to the improvements in our local indicators and the ongoing commitment of businesses and residents to do what is necessary to move forward, we announced yesterday that the directed health measure has been revised. Effective today, alcohol sales for on-site consumption may resume with certain safety protocols in place. The updated directed health measure is available online at covid.lincoln.ne.gov. And the outlines of the following requirements are this. Occupancy is limited to 50% of capacity. Parties must consist of 8 or fewer individuals, and the parties must remain at least 6 feet apart. Patrons must remain seated unless ordering food or drinks, using the restroom, or participating in games. Individuals must wear face covering anytime they are not seated. All establishments must stop serving alcoholic beverages at 10:45 and must close at 11. Establishments may offer takeout and delivery for food orders after 11 p.m. Establishments may also offer takeout alcohol sales after 11 p.m. as allowed by state law. The purpose of the directed health measure is to slow the spread of the virus. To do that, we need the cooperation of the public. Wearing a mask, keeping your distance, and washing your hands helps protect everyone. So does avoiding the 3 C's: crowded places, close contact, and confined spaces. When you ignore these precautions, you put not just yourself at risk, you also put the health of everyone you encounter at risk, your family, friends, co-workers, and even strangers. You do not want to be responsible for passing the virus on to someone. Fortunately, some of the precautions we are taking to reduce the spread of COVID-19 are also having an impact on this year's flu season. Our latest data show that flu activity remains lower than usual for this time of year in Lancaster County and across Nebraska. If you haven't received your flu shot yet, it's not too late. And this season, it's more important than ever. Flu shots protect you and help reduce the demand on our healthcare system. The health department offers flu shots for anyone in the community aged 6 months or older. Just call for an appointment at 402-441-8065 or visit health.lincoln.ne.gov. The Health Department public offices are at 31st and O Streets, and we will be closed on Christmas Day and New Year's Day.
Thank you, Director Lopez. Again, I echo your words of gratitude to all those who have taken precautions to prevent the spread of the virus over the last few weeks, especially during the Thanksgiving holiday. As Derek mentioned, we expected a surge, and that didn't materialize, and that's because of the choices you made and the actions you took to protect yourselves and our community. And the good news is that the evidence that we have in these numbers and indicators demonstrates that these precautions you're taking, they're working. Our numbers are trending in the right direction. You came together for our community and you made a difference for our healthcare system and our most vulnerable residents. And this, combined with the news of the vaccine arriving in our community, gives us a lot of hope for the future. And this winter holiday season really could be the beginning of the home stretch in our fight against COVID-19, what we anticipate will be our last great battle against the virus during this pandemic. So let's keep this momentum going and our rates trending downward. Making a few modifications to our holiday celebrations and being especially intentional this year can help retain the spirit of the season while still keeping our loved ones safe and healthy. So while you're out there shopping locally for those last-minute gifts, mask up and make a list so that you're able to shop as efficiently as possible. Make a list and check it twice, even. Many local shops are also offering curbside pickup or home delivery. If some of your family's tried and true traditions just aren't feasible this year, consider starting a new one, like writing handwritten notes to loved ones, creating special arts or crafts, or making an ornament that describes some of the good things that happened this year. There are some good things to reflect upon. It's really important for everyone to continue to take care of your mental health. Everyone's bound to have some stressful, sad, or frustrating moments, but if you or a family member's irritability, substance use, or sadness seems to be persistent or worsening, please call your family doctor or local health clinic to discuss options for getting help. It's also helpful to focus on what you can do. You can bundle up and enjoy a walk through one of our beautiful local parks for a moment of peace that's often overlooked during a normally busy season. You could take a tour of our holiday lights through your neighborhoods, the zoo, and look at what people have been doing to decorate their homes while they've been spending so much time at home. And by celebrating the holiday season safely and more intentionally this year, we can ensure that all of our loved ones can join us once again for next year's celebrations. Finally, today, we are making a change to the day of our weekly briefings. We're moving them from Fridays to Tuesdays, and we also will be then announcing the position of the COVID-19 risk dial at those Tuesday briefings. So here's the schedule for the next couple of weeks. Next week, we are not planning to hold a briefing, but of course, we'll be ready to respond to any situations which may arise. And then the following week, we will begin the Tuesday briefings. So the first one will be Tuesday, December 29th. We will continue to update the dashboard and provide media with updates every day, except for Christmas Day and New Year's Day. And with that, we want to open up the briefing and take any questions from the media. Any questions?
Yeah, this is Jared Austin with 1011 News. I have a question for Health Director Pat Lopez.
Thanks, Jared. She'll be right.
Hi, Jared.
Hi, Pat. Just a quick question for you here. I'm just looking at the dashboard, and it seems that cases and testing numbers are pretty far down this week compared to last week. Is there anything that you can attribute this to?
No, but the one thing that we do know is this is occurring statewide. And it is something that is concerning to us. We know testing is down both at Bryan's urgent care drive-through and also at Test, Nebraska. But the one thing we also know is that emergency room visits for COVID-related symptoms are also down. So it's something that we're continuing to monitor very closely, but we also see it happening statewide and also in our states that are surrounding us as well, Jared.
And then just another follow-up here, just regarding vaccines. You had mentioned that when Moderna is approved, that the state will get 32,000 vaccines. Do you know how many the county will get?
We will get approximately, I happen to know that, as of this moment in time, so just remember this is always changing. Our state, we've heard, will receive 11,700 next week if it's released. And in Lancaster County, we're slated to receive 4,900 doses. Now, we still need to remember, we still have those primary groups to work with. We're going to be vaccinating some of our rural firefighters, but we have some Pfizer vaccine that's set aside for that. But we also have the primary responsibility of making sure our long-term care staff and residents are vaccinated. So we continue to work with both Bryan and CHI St. Elizabeth too, in reaching out to those those healthcare providers that are taking care of COVID patients.
All right, thank you so much.
Uh-huh.
Other questions, media?
Hey, Mayor, this is Matt Olberding from the Journal-Star.
Hi, Matt.
We saw that there have been quite a few cases filed against establishments for violating the DHMs over the past 10 days or so. I think there were like 16 or 18. And I just wondered if somebody could, either you or if Mr. Christie's there, could talk about those efforts, whether you've sort of prioritized enforcement or those sorts of things.
Sure, Mr. Christie, right up. Thank you.
Hi, Matt.
Hi. As I said, we had just found, I think it was 15 cases filed between December 8th and December 17th. And then the night before, appears to have 18 open cases against it. So I was just curious, whether these were being open when they weren't supposed to, violating closing times, or if they're just kind of a garden variety of a number of things.
While I don't have all of the criminal complaints in front of me, I can tell you that I think that the violations that we have seen in the past month have primarily been staying open past the closing time, or open when they have been ordered not to be open. So.
Okay, thank you.
Sure. Thank you.
And just once again, we are so grateful to the vast majority of our businesses, and especially our bars and restaurants, for making sacrifices and helping to protect our community and prevent further illness and suffering. It has been really wonderful to have so much collaboration between the health department and our residents and businesses, and we remain grateful. Other questions?
Yeah, Mayor, I have a sort of a follow-up to that. Do you have you felt any pressure, I guess, from either the governor's office or from the recall effort to sort of, back down from some of these restrictions that you had put on, or is this purely just the numbers are looking good and we're sort of able to loosen things and move forward?
From the very start of this pandemic, we have had robust conversations at the city, led by our health director and her team, based on evidence and data, and in collaboration with the state for the vast majority of the time, to do what's best for the community. And that will continue to be our North Star.
Thank you.
Other questions, Jim? Okay. Thank you so much for tuning in. We wish you all the happiest of holiday seasons. It may look different, but we have a lot of hope that next year is going to look a lot more familiar. So thank you for what you're doing in the meantime to keep everyone safe so that our loved ones can gather in more traditional ways next year. Thank you for being innovative in the meantime and for doing your part to protect our community. Happy holidays.